this is Allison VILLARS. I'm with the Department of Health and Human Services at St. Tammany Parish Government, and we're back with In the Loop, which is about giving people, residents of St. Tammany Parish, information about things they might want to join or visit or use as support. I'm here this afternoon with Michael Hunley. Hi, Michael.
Hello, how are you?
Michael is an architect in Covington, Louisiana. And one day I got an email and it had Michael's name on it, and he was putting together a task force to look at and assist in a community project. So we're sort of dealing with volunteer organizations today in a way, and the first one is actually a group of volunteers who sat down together. So we're going to hear a little bit about Michael first, and then we're going to hear about the West 30s Task Force. So Michael, tell us a little bit about you.
I'm a local architect in Covington. My wife and I run our firm together for about 16 years now, and we try to stay involved in the community as much as we can. We do work for Habitat for Humanity, St. Tammany West. We've been doing that since we started, and we do work for the St. Tammany Art Association, among our other regular paying jobs. So that's about raise children, stuff like that.
Okay, so how many kids do you have?
I have 4 children, actually, ranging in ages from 32 to 6.
Oh, wow.
So,
big span.
big span, yes.
So when you actually do your architecture work for Habitat, and who else did you say?
Well, that's pro bono work we do for some for Habitat and some for St. Tammany Art Association, and low-cost work for YMCA and other people like that.
It's very nice that you guys contribute to the community, and it speaks to your efforts to work on a community in Covington, Louisiana. So tell us how the West 30s Task Force started, please.
Well, that's a story. Originally what happened was I worked, I guess it was about 2010. I was on a steering committee when the City of Covington and the North Shore Community Foundation did a neighborhood study and revitalization plan. And that produced a document. A few things have happened since then from that study, but not much, and it kind of just went on the side. And then last year, I guess, or actually it was 2016, the end of 2016, in November, Bo Elsie, who is a resident of the West 30s, came to me because he was in the St. Tammany leadership class of 2017 with my wife. And they do a tour of the West 30s neighborhood as part of the class. And he wanted to do something to help the neighborhood. So he talked to my wife, who must have told him I was on the steering committee 6 or 7 years ago. So he came to my office one day and said he wanted to do something. And neither of us knew what we were going to do. So I quickly got on the phone with Ann Bourne, who just retired but was the head of the North Shore Housing Initiative. And she suggested, rather than forming a nonprofit or some official organization, that we just form a task force. And that's what we did. So I think what I did at that point was put together a list of names with Ann and Bo of people we thought would be interested and who would be helpful, and send out an email, which probably was the email you got at the end of 2016, suggesting that we get together on a monthly basis, you know, in perpetuity, essentially, until we had stuff done, and started doing that in the beginning of 2017.
Well, it appears to me, as an external person, although I've been on the task force for a while, and I started after your first meetings, that the task force has really taken root because it's grown in size, has it not? It
has, yes.
And so how did those other people come to find out about the task force and then join?
Just word of mouth from those people suggesting other people that should show up. And it, you know, it varies who shows up at each meeting. But yeah, it has grown to involve more, not just individuals, but also individual representatives of other organizations, which is something that we really want to happen.
Okay. So can you name some of the organizations that are part of it?
Well, Terry Gage from Habitat for Humanity is always at the meetings. Ann Bourne, North Shore Housing Initiative. Of course, you and Roy from the Department of Health and Human Services. Right. Chris Brown, who's the building official with the City of Covington, is a pretty regular. He helps us, you know, figure out what the city is doing to help with blighted property and stuff like that. We've recently had some representatives from the Louisiana Workforce Commission. I'm probably forgetting others, but there's more people in there.
Yeah, I'm certain there are. So one of the things that you all wanted to do on the task force was get more community members from the West 30s involved. So tell me about your actions in that capacity.
Well, the actions don't always end in results. And so right now, of course, Bo is one of our good links because he is a long-term resident of the West 30s. So he's a good link to getting to the actual residents of the community. But so far we've had a couple of community meetings outside of our regular monthly task force meetings, and the neighborhood turnout has been kind of low. And we kind of assumed that would be happening, but I think it will get better as time goes on and we get more recognition and more attention. It's a hard thing to do.
Yeah, build it and they will come.
We hope so, yes.
Yeah. Well, my experience of those meetings is that there are some key people with questions at each meeting who live in the community and who are very interested in what the task force is all about and want something to do with their lives, to change their lives. And they have been very active at those meetings. So I think long term it will actually take root if those community meetings continue. So.
That is correct, yes. The people that did show up at the meetings were very vocal. They knew what they wanted, and we've taken all of that into our organization and tried to respond to it.
So if one of those community members were sitting here with us right now, what would you tell them the task force is all about?
Wow. Well, like I said at the beginning, the task force is not a board or a nonprofit or an organization in and of itself. Essentially it's a loose gathering of individuals and representatives of organizations that are trying to make a change in the neighborhood, and it's going to take a lot of time. It's a long-term plan, and it's going to take a lot of involvement from people in the neighborhood.
So have the neighbors helped out on any projects in the neighborhood to date? There was a cleanup project at one time.
Yeah, Brian Burns, who is with Transwestern, but in the West 30s, he formed the West 30s Redemption Company, and outside of outside of our task force, but he is also a member of the task force, and he did a cleanup. And as far as I couldn't attend, I was out of town, but as far as I know, a lot of the neighborhood participated.
Okay,
So
that's great.
it is great.
So when more projects like that are put forward, it might be that more people will decide to join.
I think they will. I mean, if you get the local schools involved, which have the children, I think the children really want to help. The adults don't always want to help, but the children get their parents involved, and so I think you will get more participation.
So there are specific focus groups you guys have talked about on the West 30s Task Force. Are you okay to talk about a couple of those with us?
Yeah, I mean, the reason we did that is because in our monthly meetings, we only have an hour. So we try not to, everything's voluntary, so we try not to take too much of people's time, and we can't really solve any issues in an hour a month. And so we have talked about certain issues such as transitional and temporary housing. There's a need for a community center which was taken away when the National Guard took over the community center that used to be there on Columbia Street. And of course there's a whole group of core community needs. And so we thought it would be a good idea to form focus groups where whoever wanted to be involved and interested in a certain area, they could get together outside of our regular meetings and focus on that and become, I mean, I want to say it's a committee because the committees are parts of boards and we're not a board. So we're calling it a focus group. So those are the three right now: temporary transitional housing, community center, and core community needs, but there will be others.
I know that in talking about the community center, that there's always an issue of money and resources to make that happen. There was some talk about, you know, USDA rural development grants and HUD grants, and I was thinking that those got moved over to the city of Covington to look at. Is that true?
Well, I think you had actually sent me some, or you or Roy had sent me some information on those, and most of those require municipal involvement. They can't just be a citizen or a private organization applying for that money. So yeah, we sent them to the city to look at. They are looking at them, but again, the focus group that's focusing on the community center, which really hasn't been formed yet, we've talked about it a little bit, nobody's really met outside of that yet, really needs to look at all the options available out there. And that has started to happen, but it hasn't gotten very far.
Okay.
So.
Well, I'd like to help with the community
Sure.
center for
There you
sure. And I'll follow up with the city of Covington on
Okay.
HUD grants and the U.S. Rural DA. So, but you said the Louisiana Workforce Commission is there. It's sort of interesting that they're there, and I know that they hook in a certain way, but what are they there to sort of assist with?
Well, honestly, I'm not sure how they got invited, and it's great that they're there. I guess Annie Spell might have invited them, or you might have invited them. I'm not sure. They started showing up at the meetings because they have funding to help with internships for any range of jobs out there. And they have the funding available, and so, I mean, part of the core community needs is employment. And so they're there to offer assistance for internships and getting people employed.
Well, one of the things I know about them, because the last In the Loop was about employment, and they were on the show, is they told us that they do those internships, and that is that they would pay for, it's basically on-the-job training.
Correct.
And so the employer doesn't have to pay all of those wages, so they get a free employee for a period of time,
For a certain
which
period
is
of
great.
time, that's correct, yes.
And one of the other things they have that they talked about was a tax incentive for employers when they're expanding and they hire a new person and they hire one person who might be underemployed or unemployed, then they can get a tax credit, which is pretty substantial for hiring that individual.
Yeah, that's something I'm not aware of.
Yeah, and I think, so the other thing I think they're there for is they have $750,000 available in training.
Correct.
So people in the West 30s and other communities could
Right,
talk
and in
to
our
them.
last monthly meeting, it was mentioned that nobody in Covington had actually applied for any of that. So
So we need to get the word out.
that's correct. That's part of what we're trying to do as the task force.
Right,
is get
so
the word out.
maybe the next community meeting can focus on some of the job stuff
I think that would be great.
and help people look at that as a possibility. I know there are partners who come and set up tables and are always there available to talk one-on-one with people at the community meetings, which is great. And that there is a topic usually about that, and then they can go off and and talk to everybody. So I think that
Yeah, and we really haven't set the agenda for our next community meeting, so
it's a possibility.
it's a possibility.
Okay. Well, you know who's up next for the last part of this In the Loop program? Do you know who we have?
I think you have Jason BURT from VOA.
Uh-huh.
Yeah, I mean, Jason is one of the people that has been active on our task force, and VOA is a great organization. We've actually worked for one of their subsidiaries, Renaissance Neighborhood Development Corporation, it's a long word, long name, who did a multifamily housing project in the West 30s called the Groves. And they are a subsidiary of VOA. But Jason and Dee Wild have been on our task force, and Jason is actually working, one of the leaders of the Transitional and Temporary Housing Focus Group. So yes, I know Jason.
Yeah, so Jason BURT will be up with us, and we're appreciative for Michael Hunley. If you're interested in volunteering or showing up for the task force meeting, you can contact Michael, or you can contact me at Department of Health and Human Services at St. Tammany Parish Government, and we'll give you the next meeting date. So all you have to do is show up. You don't have to call, you don't have to tell people you're coming, but if you're in the West 30s neighborhood, for sure we'd like for you to be there. And if you want to help in the West 30s neighborhood, Michael and the task force will welcome you. Thank you.
Research indicates that today's children may not live as long as their parents. That's why the American Heart Association created this new comprehensive health, wellness, and fitness movement, My Heart, My Life, to empower Americans to get healthier. As part of this movement, the American Heart Association is launching innovative programs in communities across the country, focus on eating and cooking healthier meals, getting daily exercise, and learning how to grow nutritious foods. We bring communities together with the common goal of improving health through fun and engaging activities like community kitchens,
My heart, my life, my community.
teaching gardens,
My heart, my life, my garden.
walking paths, and family fitness activities.
My heart, my life, my path.
With over 99% of Americans needing to improve their heart health, we want to encourage all children, adults, and families to get active together.
My heart, my life, my family.
Join the movement, myheartmylife.org.
Hi, this is Allison Villars, Department of Health and Human Services for St. Tammany Parish Government, back with In the Loop, and our visitor today, this afternoon, is Jason BURT with the Volunteers of America. So Jason, tell me what you do at Volunteers of America, what your title is, and how long you've been there.
Absolutely, I'd be glad to. I am the Assistant Vice President of Administrative Services. I have been at Volunteers of America for, it will be 12 years in February.
Whoa.
Yeah, my mother actually started working at Volunteers of America when I was about 6 months old and retired as the CFO of the affiliate I work at now, maybe 6 or 7 years ago. So Volunteers of America has been in my life for as long as I can remember.
So did you volunteer at Volunteers of America before you became an employee?
It wasn't necessarily volunteer work. It was more child labor. There were probably some labor laws that may have been broken there. But yes, I've been doing things at the offices since I was as young as 6 or 7. It's just a wonderful organization. In my current position, I oversee our human resource, technology, legal, risk, and facility needs for the entire agency. And earlier this year, February of this year, I also began to oversee North Shore Services, all of the programs and things that we provide out here, as I'm a Mandeville resident for the past 5 years.
Okay, so as a Mandeville resident, you have lived in the community for half of a decade. What have you seen as the need?
So the two big needs that I think jump out at me, the first one that I see a lot, especially in the services we provide, are mental health services. So we typically think of St. Tammany as a much better to do parish than some of the other parishes in Louisiana, especially South Louisiana. But mental health really doesn't know any kind of economic indicators. Anyone's capable of having those needs. So that's a big need in our community. Suicide, just general mental health. And then to some degree, we've got a lot of poverty in the area that can sometimes get swept to the side and we don't pay attention to. So mental health and poverty are two areas that Volunteers of America, especially our North Shore Services part, is really focusing on in the next couple of years.
Okay, well, and I know you work with other agencies, and United Way is a sister or brother agency. So they've done a program called ALLYSON. You're familiar with it, right?
Asset limited, income constrained, employed.
Right.
Yes.
So that group, that ALLYSON group, is about, as far as I can remember, about 20%, 22% of our community.
Kind of a working poor.
Right. So if you, and when we say working poor, they're struggling to meet basic needs at that point in time, paycheck to paycheck, hard to save money. So that group isn't in poverty specifically, but they could be in poverty with one emergency.
Right. They actually fall into this gap between a lot of the individuals we serve receive Medicaid services, or they are in such levels of poverty that there are safeguards and safety nets for them that we can provide services through. That ALLYSON group, that working poor group, frequently isn't making enough to maybe provide insurance or health benefits that they need, or saving enough money for a rainy day. And there aren't a lot of services for those individuals, and what United Way is doing is really wonderful, and it's something that deserves focus.
Okay. Well, I know that some of those people will show up at your offices to try and get services, and are you able to help them in any way?
It's going to depend on if they've got a disability, are they a veteran. There's a really a maze of things we have to go through to see if there's something out there that an opportunity to be able to serve them.
Okay. Well, I have a whole lot of questions for you. I mean, I have program-related questions. I have others, but this is sort of your time to focus on the things that I think are most important that our residents need to know about what Volunteers of America can do in St. Tammany Parish. So you've talked about two very significant things, behavioral health issues, mental health issues, and then poverty.
Yeah.
So why don't you start with those and give us some of the specific programs that could help people who are suffering from either of those?
Absolutely. Our permanent supportive housing program, we have been providing that service in St. Tammany Parish, Tangipahoa, Livingston, St. Helena, and Washington since 1982. So it's something we've been doing in the community a very long time. We serve individuals that may be low income, disabled, or homeless, and we provide supportive services as well as leasing services for those individuals to put them on the road to self-sufficiency, to put them in housing. Currently, we have about 99 units that will support an individual that may meet that criteria and his or her family. It's a really wonderful program. The Northlake Homeless Coalition, we use their coordinated access and assessment service. So anyone looking to receive those services actually has to be routed through Northlake Homeless Coalition for an assessment and for a group to decide on where they may be placed, what criteria they fit, and whatnot.
Okay, so people would come to your office in Mandeville to seek out these services?
They would not. They would contact Northlake Homeless Coalition at 985-626-6681, and they would connect us. So we actually provide the services. Northlake Homeless Coalition acts as the sifter to determine what services or housing may be best for them, and then they turn them over to us.
Okay, and so do you have a story you can tell about somebody who was recently housed?
We house so many people so often. The one that comes to mind, some of it is there's a lot of sensitive information. So some of the information we typically try not to share. There's some HIPAA requirements and such. But in general, it's typically an individual who has some level of disability or some consistent chronic homelessness, and we are getting them into housing. We are providing them with a case manager who's visiting or contacting them on a weekly basis. And to see them go from the lowest of lows to being self-sufficient and maybe even no longer needing permanent supportive housing is really it's years of work, but it's an amazing process to watch.
Well, earlier we heard from Michael Hunley about the groves,
Yes.
which you guys at VOA were responsible for,
Yes.
and for the cottages at the groves.
Yes.
So tell us about the
Yes.
groves,
So
please.
we call the entire property the Groves at Mile Branch, and it was developed by our subsidiary, Renaissance Neighborhood Development. They built these apartment complexes, 94 units, 65 of the units, the rent is income-based. So an individual's amount that they would pay for their rent on a monthly basis is actually dictated by their income. The remaining 29 apartment units are market-based. So it's mixed income. It's not just individuals that may have income issues, and it's not just market-based trying to make the most money. It's a mixed income solution. And then there are 25 what we call the cottages. These are individual parcels of land around the property that are single homes, and they are available for lease to own. 25 units, 13 are actually set aside just for veterans.
Okay, and how many of them are filled?
Right now, I don't know exactly how many are filled. I believe they're all available, the 25 that are out there. That's the latest numbers I've gotten.
Okay, when you say all available.
All 25.
Okay.
And the 13 for veterans. I believe we've just finished the last ones.
Okay, so they all are filled right now and have somebody available?
Available for lease to own,
Okay,
yes.
great. So
Absolutely.
of the apartments, how many are filled, do you know?
I know all of there's a waiting list for the income constrained or income apartments. Those have a waiting list, so you definitely want to call and try to get on that waiting list if you feel like you might meet that criteria. There are several 1, 2, or 3 bedrooms open in the market rate apartments.
Okay.
So there is availability there. And that market, while we say market rate, typically can be lower than what someone may be charging in the area. So it still may be, affordable housing for an individual compared to what their current circumstances are.
Yeah, I've been out there. I love how they look.
It is. It's a beautiful property.
I'm particularly interested in the banisters on the houses, the ones that go lateral instead of vertical.
Yes.
I thought that was a really great
Our
trick.
development corporation is got a very talented individuals, Vanessa Levine and Victor Smeltz. They do an unbelievable job. There's other properties in New Orleans proper. They've done that senior housing that is just beautiful. It's unique, it's colorful. It's not just, it doesn't look like just any other housing.
So you're wanting to put senior housing out there, I understand.
Yes. So earlier this year, we submitted a proposal for this acre of land that we have out at the Groves, and we were going to do senior housing, some additional units, I believe around 25, and we recently got word back that that was unsuccessful. So Victor and his team at Renaissance Neighborhood Development have kind of gone back to the drawing board and are investigating what options kind of are still out there for them.
Okay. So we've talked about housing, a great deal, supportive housing, and we've talked about one of the locations that you guys have been really responsible for, and we're really happy in the community to have that, particularly since it's located in the West 30s, which is great. What are the other programs we need to know about and we need to tell all of our residents about?
I think one of the bigger ones that is especially with the Medicaid expansion recently, is our behavioral health program. We provide what we call a care coordinator, who is typically a licensed or master's level clinician, will go out in the community for individuals that may have a mental health disability, and they will provide care coordination services. So if an individual believes they might have a mental health disability and have Medicaid through one of the 5 Healthy Louisiana choices, that individual may be eligible for our behavioral health program. A lot of the federally qualified health clinics and centers, they provide inpatient services. We do community-based. So our clinicians are on the road, they're meeting individuals in their communities, in their homes, and they're providing these services at the individual sites. Anyone can contact us directly if they think they have a loved one or themselves may be eligible or may feel that they have a mental disability that needs to be assessed. Anyone can be assessed for completely free. Their insurance will cover it. If they meet a certain threshold of need, they'll actually be assigned a certain number of units that can be provided for a given period of time. And then we develop a relationship and we start helping an individual with their mental health needs. When they privatize Medicaid the last couple of years, what the insurance companies have found is if an individual has a severe primary care need, if they've got high blood pressure, heart disease, diabetes, they will not take care of that need if their behavioral mental health isn't right first. So if a person is dealing with bipolar or schizophrenia, that's going to cost an insurance company X amount of dollars. But that, in conjunction with a major heart disease, for instance, could cost that insurance company much, much more, and that frightens them. And what they're doing now is they're trying to get in front of that. They're trying to provide these really very, very, very targeted and needed services on the mental health side to try to help that primary care. So if you're not taking your blood pressure medication if you've got schizophrenia, so the cause, the symptom, the root of the cause we need to get at is that mental health before we can even begin to treat the primary care side.
Okay, well, we've covered that. We have a very short amount of time
Yes.
left. So I'm going to name a couple of programs, and you're going to give me a couple of words about them, but
Yes.
only a couple. So tell me about veterans.
Veterans. So we have transitional housing, two facilities in the New Orleans area. We don't do actually any veteran services in St. Tammany Parish
Yet.
but we would absolutely love to. It's a need. It's not at a level that New Orleans is, but there are homeless veterans here and they need services.
Right. Okay, adoption.
Adoption is one of the oldest programs Volunteers of America provides. It has tailed off in the last 10 or 20 years, but we still provide those services. We actually provide maternity services as well. So calling Volunteers of America, if someone's even thinking about adoption, they could receive maternity services in addition, even if they decide not to go forward with adoption.
Okay. I love this quote that's on your website. You said, not every American lives the American dream. And you guys have a whole poem written about this. This is why we do what we do.
Yes.
And we don't really have time for too much more, so I want to sort of end with that and talk about, you guys were formed in 1897, and so you've been around how many years?
120 years, an offshoot of the Salvation Army. So our founders, Maud Ballington Booth, their father was one of the founders of the Salvation Army. And I think when people ask what we do, the simplest thing I always say the core of what we do is we serve the most vulnerable.
Okay. And last but not least, you're changing your name from Volunteers of America Greater New Orleans
Yes.
to
Volunteers of America Southeast Louisiana. On January 1st, it will be official to better represent the 16 parishes we kind of we work with in the southeast portion of the state.
And I'm going to tell y'all that we're really glad Jason Burt lives in Mandeville and has responsibility for North Shore. He's a great partner in St. Tammany Parish. And if you have needs for Volunteer of America, please make sure you make a call to them. They'll get you to the right people. Thank you so much for joining us with In the Loop today. We'll be back for our 4th show in a month. Thanks. Bye.